Hey everyone, welcome back to Nursing Simplified. Today we're diving into one of the most tested topics in nursing school and on the NCLEX, antibiotics. I know what you're thinking. There are so many names, so many drugs, so many side effects. How are you supposed to remember all of this? Here's the secret. You don't need to memorize every single antibiotic. You need to understand them by class. Once you know the class, you know the patterns. And patterns are your best friend in nursing school. So grab your notes, pause when you need to, and let's break this down. Before we jump in, here's why learning by drug class is a game changer. Antibiotics in the same class share similar mechanisms, how they kill bacteria, similar side effects, what to watch for, similar suffixes, so they're easier to recognize, and similar nursing considerations. So instead of memorizing 50 drugs, you're learning patterns. Let's start. First, penicillins. These are your classic antibiotics. To spot them, look for cillin, Amoxicillin, Ampicillin, Penicillin. They are bactericidal. They kill bacteria by destroying the cell wall. Think of it like popping a balloon. They mostly treat gram-positive infections, like strep throat, ear infections, and skin infections. Nursing considerations. Always check for allergies. Penicillin allergy is very common. Watch for cross-reactivity with cephalosporins. Monitor for signs of allergic reaction, rash, hives, difficulty breathing. Most should be taken on an empty stomach, except amoxicillin. Memory trick. Penicillin pops cell walls like a balloon. Next, cephalosporins. Think of them as penicillin's cousins. Look for Ceph or Ceph. Cephalexin, Ceftriaxone, Cefazolin. They come in generations. As the generation goes up, gram-negative coverage increases and gram-positive decreases. First generation, good for skin infections. Third generation, used for meningitis and gonorrhea. Nursing considerations. There is some cross-allergy with penicillin. Watch for GI upset. Ceftriaxone should never be mixed with calcium in neonates. Also, watch for superinfections like C. diff. Memory trick. CEF sounds like chef, and a good chef covers everything. Next, FLUOROQUINOLONES. Look for Floxacin, Ciprofloxacin, Levofloxacin. They stop bacteria from reproducing by inhibiting DNA synthesis. They treat UTIs, respiratory infections, and more. But these come with serious warnings. Tendon rupture, peripheral neuropathy, CNS effects like confusion and seizures. Avoid in children and pregnancy unless necessary. Don't give with dairy, antacids, or iron. Encourage fluids. Watch for QT prolongation. Memory trick. Flox your muscles? No, protect your tendons. Next, macrolides. Look for Thromycin, Azithromycin, Erythromycin. These are bacteriostatic. They stop bacteria from growing. They're great for respiratory infections and for patients allergic to penicillin. Nursing considerations. GI upset is very common. Watch for QT prolongation. Be aware of drug interactions. Memory trick. Macrolides slide into the ribosome. Next, AMINOGLYCOSIDES. Look for mycin in drugs like Gentamicin and Tobramycin. These treat serious infections, especially gram-negative. Two major toxicities: ototoxicity, hearing loss; nephrotoxicity, kidney damage. Monitor drug levels. Check kidney function. Memory trick. Aminoglycosides are mean to your ears and kidneys. Next, tetracyclines. Look for cycline, doxycycline, tetracycline, used for acne, Lyme disease, and respiratory infections. Nursing considerations. Photosensitivity. Patients burn easily in the sun. Avoid dairy, antacids, and iron. Do not use in pregnancy or children under 8. Take with a full glass of water. Memory trick. Tetracycline in the sun. You'll get burned. Quick mentions. Sulfonamides. Watch for sulfa allergies and severe skin reactions. Vancomycin, used for serious infections like MRSA. Watch for red man syndrome. Infuse slowly. Carbapenems, last resort antibiotics. Watch for seizures and superinfections. Let's recap. Learn the suffixes. They tell you the class. Each class has its own pattern of side effects. And remember the big risks: kidney damage, hearing damage, tendon rupture, allergic reactions. You've got this. If this helped you, hit that subscribe button and stay tuned for more simplified nursing content. Drop a comment. What antibiotic class confuses you the most? Keep learning, keep growing, and I'll see you in the next video.